Welcome back, Ben Nemzer from the Cohen Foundation again. This panel, we're going to talk a little bit about infection-associated chronic illnesses. And with me today, I have Dr. Sue Visser and Dr. Julie Liao, and they can introduce themselves. Why don't we start with Dr. Visser?
Hi, Ben. Yes, I'm Dr. Sue Visser, and I am Associate Director for Policy and Extramural Program here in the Division of Vector-Borne Diseases at the Centers for Disease Control and Prevention. And Julie.
Hi, everyone. I'm Julie. I'm the Director for the Forum on Microbial Threats here at the National Academies of Sciences, Engineering, and Medicine.
Great, thank you. During this panel, we'll briefly discuss an upcoming symposium on infection-associated chronic illnesses. These chronic illnesses, such as long COVID, ME/CFS, persistent Lyme disease, and MS, start with a pathogenic infection, but symptoms persist for months, years, or decades after this initial infection. The Cohen Foundation is proud to collaborate with the CDC and the National Academies of Science, Engineering, and Medicine to explore commonalities and research opportunities across these infection-associated chronic illnesses. So I'm going to pose a question to Sue. Can you describe CDC's interest in infection-associated chronic illnesses and why they are important to collectively research?
Sure, and I'll share just a couple of slides to guide our discussion today. As I know you all know, we have a few programs here that I think are relevant to this discussion. The first is COVID-19, the second is Lyme disease, and the third is ME/CFS. And chronic fatigue syndrome is also what they refer to in terms of ME/CFS. These three programs all have dedicated funding at CDC for us to focus our programmatic efforts on. And Ben, I was really happy to see you approach CDC and ask us if we would collaborate with you on focusing on this really important issue related to some of the persistent effects that patients experience after infection with a number, actually, of different pathogens. And when we sat down and looked at it together, it is very, very clear that infection-associated chronic illnesses reflect a growing public health concern. We see this kind of pattern of persistent symptoms that are extraordinarily debilitating across long COVID, ME/CFS, which has a whole host of different causes, persistent or post-treatment Lyme disease, and also multiple sclerosis. And when we sit down and look at the actual numbers, we see really tremendous disease burdens, somewhere around 7.7 and 23 billion patients, not billion, millions of patients who will be living with long COVID by February 2022. That was a projection, and we're pretty clear that we have certainly hit at least the middle of that. For ME/CFS, we know there's somewhere between 1.7 and 3.3 million patients in the US diagnosed with ME/CFS and experience chronic multi-organ symptoms. For Lyme, where I sit in vector-borne diseases, we know there's about 2 million patients in the US living with persistent or post-treatment Lyme disease syndrome based on our analysis of claims data. And so certainly this is likely to be a lower estimate. And then also for multiple sclerosis in the US, more than 700,000 patients are living with MS. And all of these issues really result in long-term, deep impacts on the patient and their family. And what's common across all of them is we don't know how to treat these patients. We don't have good therapeutics for them. We don't understand the cause for most of them. And really, like, we're at a loss of how to support the public in terms of improving their health and well-being. So it was with great interest that we initiated this conversation with you, Ben, at the Cohen Foundation, and both ME/CFS and the Lyme program contributed funding to try to support digging into this issue and trying to find some common solutions where we can leverage all the resources across these different diseases and trying to find some solutions that will actually help patients improve their functioning and hopefully become fully well. So we turned to Julie and her colleagues at the National Academy of Science, Engineering, and Medicine to talk about a possible workshop. We approached her and developed the set of questions collaboratively with her. First, we would like a workshop to consider overlapping clinical and biological factors underlying infection-associated chronic illnesses, looking for commonalities across all of these different causes of infection-associated chronic illness. Look at the current practice and novel technologies to develop urgently needed diagnostic tests for different stages of illness. And as you know, in Lyme, we are really plagued with having a difficult time identifying Lyme disease and the impacts of Lyme disease at multiple stages of disease. So this is really important for us. Number 3 is identification of therapeutic targets and strategies to prevent or impede chronic illness progression, right? We want to stop this from before it starts so that we can improve patient outcomes. And number 4, coordination and collaboration among various stakeholders and practitioners that will increase research and enhance care across different patient populations. And more and more, we are looking for meaningful partner and patient engagement, so we can have better outcomes when we sit down to try to design and find our solutions to these really, really intractable problems. So with that, I'll turn over to Julie and your questions that you may have for her.
Great, thank you so much, Sue. And thank you so much for collaborating on this and moving this along so well over the last few months. So Julie, can you give us a little bit of background on the National Academies, as well as why you think it would be a good forum or a good location for this symposium?
Yeah, sure. And I also have a few slides that can help to guide the discussion and, record some of the information that I'll be sharing. So I do want to continue with what Ben and Sue already shared and just give you a little bit more detail on this upcoming workshop. It is slated for June 29th and 30th, 2023. But first, I want to begin by describing who we are at the National Academies and help everyone get a sense of why we're hosting this workshop. So to begin with, the National Academies, despite its name, we are not a government agency. Instead, we're a unique independent advisory body to the government and the rest of the nation on science, engineering, and medicine issues. We were established by a congressional charter under the Lincoln administration. So this long history and our organization lends several strengths to the work that we do. So it's kind of going back a bit. The National Academies is used as an umbrella term for 3 honorary societies: the National Academy of Science, of Engineering, and Medicine, and also the National Research Council, which is the operational arm where I sit, where we, carry out these work to help the nation focus and arrive at solutions for these issues. So some of the strengths that we draw on to carry out our work, because of the way we are established, we have access to top experts through a diverse field, between science, from engineering to medicine, and also beyond. The service that people provide to us on these expert committees that we convene to inform our work, such as this workshop, are strictly volunteer service. And we conduct our work independently so we can maintain scientific objectivity and balance. And then, our work is also subject to other quality control procedures that the Academies has established. So within the National Academies, the Forum on Microbial Threats is a long-standing convening activity that has been around since 1996. Our central charge is to facilitate cross-sector dialogue and collaboration to stimulate new thinking, specifically addressing research and action around emerging and re-emerging infectious diseases, but also their impact. So our forum right now has 26 members with diverse expertise to reflect this charge. We also regularly work with researchers and stakeholders outside of this membership. And for this specific workshop, we are collaborating with our colleagues at the Forum for Neuroscience and Nervous System Disorders. And you can find more information about both of our groups. The Forum on Microbial Threat is the lead on this, and we call them the Neuroforum is the collaboration. And I've provided the links below where you can find more information about us. And in addition to drawing on the strength of the work that we do at the Academies generally, the reason why we're collaborating together with CDC and the Cohen Foundation is because both our forum and the Neuroforum have specifically addressed questions and issues in the past related to these infection-associated chronic illnesses. So I'm just showing a few examples here of our publications. More of them can be found. It's available for free public access on our webpage from the previous slide. And I just want to point out that our work on the left side, the 3 publications on the left, focus on connections between infectious diseases and chronic disease or non-communicable diseases. Whereas the Neuroforum has a rich body of work on research innovations and policy considerations involving the neurological and neuroinflammation aspect of disease areas. So that's why our 2 groups have come together at the Academies to work with the CDC and the Cohen Foundation to plan this workshop. We've titled this "For the Sake of Our Activities Toward a Common Research Agenda in Infection-Associated Chronic Illnesses." And this workshop will, like Sue explained, explore the current understanding and future research opportunities broken down to these 4 bullets. And, the overarching goal of what we want to do is acknowledging that there is a rich body of existing work, but at the same time, new data and new findings continue to emerge. And what we hope to accomplish are, number 1, to convene researchers in a more coordinated community to share knowledge and work together to better serve the different patient populations. Number 2, to identify future research directions in this coordinated way. And number 3, to build evidence to inform policy decisions in the future. So as it is with all of our work, there will be a committee of external subject matter experts who are serving as a volunteer capacity to provide the intellectual leadership to help us plan and convene the workshop. I haven't included on the slides because it's already a bit busy, but the expertise we are looking for includes infectious diseases, autoimmune inflammatory diseases, neurological diseases, and also people who do work in clinical research and practice, in biomedical research and development, and of course, patient advocacy, bioethics, and health equity perspectives. So on my last slide, I also just want to give a preview that following the workshop, we will be publishing a proceedings that serves as a factual accounting of discussion at the meeting. So it helps to record what was discussed and ideas that were sparked at the meeting. The nature of the workshop that we convene is to illuminate important issues such as this, identify potential future directions or needs, to stimulate new thinking and to facilitate building collaborations. So the proceeding will highlight all of the above, but it will not issue consensus findings or recommendations from the academies. We expect, given the timing of the workshop, we will expect this proceedings to be available early 2024. And once it's available, it's freely available for people to read online, download as a PDF, or even as a hard copy if you would like to have that. So we're still in the early stages of planning this workshop, but if anyone is interested, I encourage you to go to the link below or to scan the QR code so you can share your contact information and we can send you updates when the workshop registration opens. So I think with that, I will stop share and take any other questions or participate in the discussion.
Thank you so much, Julie. I guess one question. So the workshop is going to be a variety of stakeholders, researchers from a variety of different fields. How does the public get involved in terms of the viewing and the potential results?
Mm-hmm. Yeah, so coming from the COVID era, all of our workshops nowadays are going to be hybrid. So there will be an option to view the workshop online. Tentatively thinking and planning, we will have a live webcast of at least part of the workshop, if not the whole workshop. We're still working on the details of that. So the public can, number 1, view the workshop online, and number 2, we will be setting up a Q&A box to take in real time public questions and relay them and incorporate them into the discussions with the experts. And number 2, if anyone's interested, they can always navigate to the workshop webpage through the link I provided earlier on the forum on microbial threads. And there is an email there. So you can contact us at any time through the email with suggestions, with recommendations. We are monitoring it.
Great, thank you so much. I think that's it for us. I mean, I want to just let everyone know to stay tuned and to click on the link, and we'll provide the link that that Julie had posted, so you can keep posted for this, I think, influential forum in June 2023. Thank you both, Dr. Visser and Dr. Liao, for taking the time today.
Thanks for having us.
Yeah, thanks for having us. Really looking forward to it.